Well, it's time now for Thursday Health Report, and joining us is Africa 54 Health correspondent Linord Moudou to talk about a new technique that might save you some pain. Linord.
That's right, Vincent. A new technology developed by British scientists could dramatically reduce the need for unpleasant dental drilling. Developed by UK-based company Linord, the technology can painlessly repair teeth by supercharging the remineralization of tooth enamel. Demineralization, which makes tooth enamel weaker and more porous, occurs when dental plaque bacteria ferment sugars in the mouth that in turn produce acid that pull out the minerals in the tooth. If not caught early enough, it results in dental caries, also known as cavities or decay. These can only be dealt with by drilling away the affected area and replacing with a filling of amalgam or composite resin, starting people on a lifelong cycle of repair and replacement. Linord's technology supercharges the natural process of remineralization.
Trying to supercharge a natural process whereby there's a process called remineralization. It happens in your mouth all the time. And we've just found a way to make that a much faster process, driving healthy calcium and phosphate minerals into your enamel, and through a natural process it will bind on and add to the enamel that's there. This can make a major impact on global dental healthcare in that the availability of a caries treatment in developing countries, our treatment's much more portable and useful in that type of environment as well.
Linord is seeking further investment to develop the prototype device into a model ready for use by dentists. The company says the market-ready device will cost about $10,000, with treatment packs selling for less than $10. Now, for many years, girls in Somalia have been forced to undergo female genital cutting, a brutal practice that has life-threatening side effects. However, as Abdulaziz Billow reports, if a new law is enacted, those found practicing the act will face criminal charges.
Hope at last for girls in Somalia as the government signals its intentions to ban female genital mutilation, a brutal practice girls in Somalia have been forced to undergo for years. The practice is very popular in many African and Middle East countries. According to figures by the United Nations Children's Fund, female genital mutilation in Somalia alone stands at 98%. Among its effects are lifelong pain, infections, infertility, and difficulties during childbirth.
In the past, when girls were subjected to FGM, it used to be something the society was proud of, but it's no longer the same. People shy from being associated with FGM. Now, when parents want their daughters to undergo FGM, they opt for underground avenues rather than public. That's a clear indication that the number of cases has drastically reduced.
Now, the government is creating a clear policy that will end the practice. Religious leaders, community heads, and the country's lawmakers are considering legislation initiated by the Ministry of Women. Once the law comes into use, those found practicing the act will be arrested.
To all those who practice FGM, we have seen the effect it has. This practice has to come to an end. The ministry is also working on establishing a law to ban FGM. If anyone will be found practicing this culture, they will be arrested by the government.
Experts say a community mobilization effort will help end the practice and raise awareness of the law in a country where the practice of female genital mutilation is almost universal. The practice has been outlawed in 18 other African countries. Experts say eradicating the brutal practice in Somalia will take time, but banning it is a major step to ensuring that Somali girls will have a normal life in the future. Abdulaziz Billow for VOA News, Mogadishu.
That's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thanks a lot. Now be sure to watch Linord Moudou's Health Report every Tuesday and Thursday right here on Africa 54.